Now, the National Drug Authority has warned the members of public of a Chinese contraceptive pill which is currently in the Ugandan market but causes cancer and infertility among women. According to the National Drug Authority, the unauthorized Chinese pill is being sold on black market and used as a contraceptive with its packaging, labeling and patient information leaflet all in Chinese language except for the claimed ingredients. Levonorgestrol and Quinestrol. To make sense of the ban, in studios with me, I have Mr. Abias Rwamiwiri, the spokesperson to the National Drug Authority. Good to have you, Abias.
Thank you, Andy, and thank you for having me here.
For starters, how did this pill get here? Yet we have quite a lot of checks at the entry point in the country.
Thank you so much, and that's the question that has been, the questions among the questions that are being fired to us. How did it get here?
Yep.
As you clearly mentioned, it's on the black market, meaning it's not authorized. And what is not authorized becomes a criminality. Ugandans should know that there is a lot of money involved in drug business. And because of that, it attracts crime. According to WHO, the World Health Organization, illegal drug or the money that comes that is driven by crime in drug business counts to almost 25% in developed countries. We're talking about US and Europe and other developed countries. In developing countries like Africa, it counts up to almost 40%. So this is not a case for Uganda, and that's why every country has a regulator like National Drug Authority to keep an eye, but also to remind Ugandans that we are up to a big task of keeping them safe, but they have to work with us. But because this product got sneaked onto the market, through our post-market surveillance, we were able to detect, but Ugandans were actually taking it and keeping quiet. From our intelligence, whoever has this product, when you walk into a press that sells it, they don't actually give you it in the package. They, open the package and give you the tablet. And I mean, most of the people who are using these contraceptives are guys, the corporate class who have gone to school like me and you, who should take responsibility about their health and know that you can't get a drug just through the hands of Andrew behind the counter.
Again, it brings me to the question. NDA's mandate is to keep the eye open. People were claiming on Twitter and the other platforms that they have been using this for the last 3 years. How often does NDA do field surveillance to know what is on the market that they can be capped in time? And where were NDA eyes upon entry?
One is that before we allow a product onto the market, it goes through the process. Whether it is manufactured here or abroad, with our teams of inspectors start from the kitchen where it is going to be cooked from, the factory, and ensure, because the quality of the drug cannot be only tested, it is inbuilt. And that's when you had issues of this syrup in Gambia that was contaminated. So to avoid that, we go through the processes of the manufacture of the entire product to certify them. Then we issue importation certificate. Now those are the products that we allow onto the market, and where they are kept, where they are distributed throughout, we keep an eye. Now for a product that is smuggled, knowing that Uganda has porous borders, knowing that we have people, affluent people like you, Chamagero, who travel, hide some of those small drugs within your clothes, that even when they are scanned through the checkpoint at the airport, it's luggage. And you keep going, you go with your child, your children, the entire family, you can bring in as much. And those products are able to be sold behind the counters where, it is you, and most of these products are actually consumed through peer recommendation. So Abias asks Andrew which product they use, and they said, I have this this magic bullet that has been working for me, and they even direct you where to go. So this crime is highly concealed. But as National Drug Authority, when we heard about it, sometime about 2 months ago, we went on the hunt. We were able to get some of these. We are still, our intelligence, our enforcement teams are still following to get some of the the kingpins who bring these and consider them as other things, because we have also heard that some of them actually taking them through the regular importation process and consider them as other products, because they have removed the packages and
so
that you can't even see.
A few years ago, you banned a drug called ranitidine, but it's still on the market. So how effective are your bans as NDA? We've
actually recorded several products. It's only what the public gets to know, and that's the beauty with social media. People go and make wild claims. We've banned products, several of them, record them, and we put out the notice. But also we put pressure on the importers and manufacturers to make sure that they are pulled out off the market. As far as we know, that specific product has been removed from the regulated supply chain. Now, after issuing a notice, it is also upon the public to ensure that they take note of those impure products and they do not use them. As National Drug Authority, we are not leaving that burden on the Ugandans. We have put the drug outlets that we have issued license to take it upon themselves to ensure that they don't sell a product that we have not authorized, a product that we have recorded. Otherwise, we will withdraw our license. And that we are doing it to protect Ugandans.
Thank you so much. That is Mr. Abias.